So the drugs today I'm going to read is uh, let's see till where I completed. I Hyoscyamus. No, Ignatia. So the Ignatia bad effects of anger, grief or disappointed love, calcarea phos and Hyoscyamus. Ignatia. Ignatia. Bad effect of anger, grief, disappointed love, calcarea phos and Hyoscyamus. Then broods in solitude. Hello. रुक एक सेकेंड. हाँ यार ठीक है. Bad effect of grief, disappointed, bad effect of anger, grief or disappointed love, calcarea phos, Hyoscyamus, broods in solitude over imaginary troubles. Constitution, what will be the constitution of Ignatia? Especially suited to nervous temperament, woman of a sensitive, easily excited nature, dark hair and skin, but mild dispositions, quick to perceive, rapid in execution. Rapid in execution in striking contrast with the fair complexion, yielding lachrymose but slow, and indecisive pulsatilla. Mental condition rapidly in an almost incredible short time. Changes from joy to sorrow, from laughing to weeping. Coffea crocus, nuts moscata and moody. Okay. Person mentally and physically exhausted by long concentrated grief. By long concentrated grief. Uh, Desire to be alone, finely sensitive mood, delicate consciousness, inconstant, impatient, irresolute, and quarrelsome. Amiable in disposition or if feelings well, but easily disturbed by very slight motion, easily offended. The slightest fault finding or contradiction excites anger. The slightest fault finding or contradiction excites anger, and this makes him angry with himself. Okay. Children, when reprimanded, scolded, or sent to bed, get sick or have convulsions in sleep. Ignatia. Ill effects from bad news, from vexation with reserved displeasure, from suppressed mental suffering of shame and mortification. Staphylos aureus. The remedy of great contradiction. The remedy of great contradiction, roaring in ears, amelioration by music. The piles ameliorated when walking, sore throat feels when swallowing, amelioration by when swallowing, empty feeling in stomach, not by aggravation, amelioration by eating, cough, aggravation the more he coughs. Okay. Cough on standing still during a walk. Okay. Involuntary sign, lachesis. uh, Cannot bear tobacco. Smoking or being in tobacco smoke produces or aggravates headache. Can't bear tobacco, smoking or being in tobacco smoke produces or aggravates headache. Sweat on the face on a on a small spot. Sweat on a face on a small spot only while eating. Ignatia. Oversensitive to pain. Oversensitive to pain. Coffee and chamomilla. Pain in small circumscribed spot. Complaints written at precisely the same hour. Headache as if a nail was driven out through the side, relieved by lying on it. Coffee or nux tuja. Stomach and abdomen weak, empty feeling at pit of stomach, not by eating. Weak, empty feeling at pit of stomach, amelioration by eating, not ameliorated by eating. Okay. Constipation from carriage riding of a paralytic origin. Constipation from carriage riding of paralytic origin with excessive urging felt more in upper abdomen with great pain, dreads to go closet in women who are habitual coffee drinkers. Okay. Prolapsus ani from moderate straining at stool, stooping or lifting nitric acid, podophyllum, ruta. When the when the stool is loose, hemorrhoid prolapse with every stool have to be replaced. Hemorrhoids prolapse with every stool have to be replaced. Uh, Sharp stitching. Hemorrhoid prolapse with every stool have to be replaced. Sharp stitches shoot up the rectum. Nitric acid aggravation by for hours after stool. Retania and sulfur. Uh, Central nervous system twitching, jerking, even spasm of single limbs or whole body when falling asleep. Fever, red face during chill, ferrum, chill with thirst during chill only by external heat, heat without thirst by covering. Okay. Ignatia bears the same relation to the disease of women that Nux does to sanguine and bilious men. Okay. Now the next remedy I am going to read is iodine. It's an important remedy for uh, kids. Person of a scrofulous diathesis with dark or black hair and eyes, a low cachectic condition with profound debility and great emaciation, abrotanum. Okay. Ravenous hunger eats freely and well, yet loses flesh all the time. Ravenous hunger eats freely and well, yet loses flesh at the time, all the time. Abrotanum natrum mu sanicula tuberculinum. Suffer from hunger, must eat every few hours, anxious and worried if he does not eat. Sina and sulfur. Feels uh, feels ameliorated while eating or after eating when stomach is full. Okay. Respiratory system great weakness and loss of breath on going upstairs. During the menses alumina carboanimalis and cocculus. Croup membranous hoarse, dry cough, worse in warm wet weather with wheezing and saving respiration. Spongia. Itching low down in the lungs behind the sternum, causing cough extends through bronchi to nasal cavity. Child grasps the larynx, sepa, allium sepa, face pale and cold, especially in fleshy children. Okay. Stomach and abdomen, empty eructation from morning to night as if every particles of food was turned into air. Empty eructation from morning to night as if every particle of food was turned into air. Constipation with ineffectual urging by ameliorated by drinking cold milk. Heart and circulation palpitation worse from least exertion compared digitalis from least mental exertion. Sensation as if the heart was squeezed together as if grasped with an iron hand. Hypertrophy and induration of glandular tissue, thyroid, mammary, ovaries, testes, uterus. Hypertrophy and induration of glandular tissue, thyroid, mammary, ovaries, testes, uterus, prostate or other glands, breast and may dwindle and become flabby. Hard goiter in dark haired persons, light haired bromium feels amelioration after eating. Female reproductive system, leukorrhea acrid, corrosive, straining and corroding the linen, most abundant at times of menses. Cancerous degeneration of the cervix, cutting pain in abdomen and hemorrhage at every stool. Now the next remedy I am going to read is ipecac. In all disease with constant and continual nausea. Common name is ipecac rubiaceae. Okay, common rubiaceae. In all disease with constant and continual nausea, hemorrhage, active or passive, bright red from all the orifices of the body, region and millefolium, oversensitive to heat and cold, pain as if bones were all torn to pieces, respiratory system, cough, dry, spasmodic, constricted, asthmatic, cough, dry, spasmodic, constricted, asthmatic, difficult breathing from least exercise, violent dyspnea with wheezing and anxiety about the stomach, woofing cough, child loses breath, cough, dry, spasmodic, constricted, asthmatic, difficult breathing from least exercise, violent dyspnea with wheezing and anxiety about the stomach, woofing cough, child loses breath, turns pale, stiff and blue, uh, strangling and gagging and vomiting of mucus, bleeding from nose or mouth, indigo. Cough with rattling of mucus in bronchi, cough with rattling of mucus in bronchi when inspiring, antium tart, threatened suffocation from mucus. Okay. Adaptive to cases where the gastric symptoms predominate. Tongue clean or slightly coated. Adapted to cases where the gastric symptoms predominate. Antium crudum and pulse. Adapted to cases where the gastric symptoms predominate. Tongue clean or slightly coated. Nausea with profuse saliva, vomiting of white glary mucus in large quantities. Without relief, sleepy afterwards, worse from stooping, the primary effects of tobacco of pregnancy. Stomach feels relaxed as if hanging down. Stomach feels relaxed as if hanging down, clutching, squeezing, gripping as from a hand. Iris Tinax, the important remedy for the uh, appendicitis. Yeah, appendicitis. Despite exhaustion compelling one to keep in bed, itching and burning of scalp on awaking without eruption, burning in the eyes without tear, burning in the throat and fauces as if on fire, not relieved by cold water, fearful burning in throat. Okay. Absence of saliva with a dry mouth. A remedy of special applicability in appendicitis. Cutting in the abdomen more severe right than left. Fearful pain in the ileocecal region. Pressure in the ileocecal region causes deathly sensation at stomach pit. Pain continued until he vomited a cupful of dark green bile. Constipation bowel constipation bowels did not act normally for 10 days after the proving. Okay. Now the next remedy I am going to read is Kali Ars. Kali is important remedy. Kali Ars, an anti-syphilitic remedy. Kali Ars is anti-syphilitic remedy. Its look is something startling. Eyes are brilliant, protruding, face red. It looks is something startling. Eyes are brilliant, protruding, face pale, while the cheeks are sunken. Complete aphonia following red skin affection. Complete aphonia following skin affection. Tongue swollen, felt too large in the mouth. Tongue clear red like raw beef. Nodular eruption on face, boils on face. Palm and sole sprinkled over with corns. Palm and sole sprinkled over with corns. Varicose veins of leg, gouty nodosities. Acne appearance like that in early stage of smallpox. Epithelial cancer. Kali Ars, epithelial cancer. Skin cancer where suddenly an alarming malignancy without any external signs set in. Skin cancer where suddenly an alarming malignancy without any external signs set in. Dry chronic eczema, very irritable itching tickling when gets warm. Dry chronic eczema, very irritable itching tingling when she gets warm. Numerous small nodules under skin. Psoriasis, scaly itches causing the patient to scratch till an ichorous fluid discharges, forming a hard cake. Discoloration of the skin after psoriasis and lepra. Psoriasis in numerous patches with great itching, cauliflower exertions of os uteri with flying pains, pressure below or os pubis and sticking discharge. Okay. Calibicromium. Fat, Calibicromium fat Yes, BHMS people are also doctor. You don't know? Sarcastic boy 8464. Have you been? Have you gone through any homeopathic hospital or Dr. Samuel Hahnemann is biggest stupid ever? Why? He left the allopathy because of that. You know, Dr. Samuel Hahnemann, he was a allopath, but he left the allopathy. After that, he joined. He no no. You should go once. First, you should go and see. You should take a medicine. After that, you will comment. You should comment on homeopathy. Just because he married at the age of 60, do you know about it? Yeah, I know. At least you should go Kolkata. Go and see the National Institute of Homeopathy once and see there how many patients are there without getting treated or without getting cured. They are going there. Lots of homeopathy, lots of allopathics are converting nowadays are converting into homeopathy. Do you know this? Huh? Do you know this? Lots and lots of allopathics converted into homeopathy. Do you know? This is there is this much dilution in the medicine. The ratio is 1:2. How does homeopathy work? You should take medicine actually. No, if it doesn't work, okay, take a bottle of belladonna. One remedy I am telling you: take a bottle of belladonna, and 2 or 3 days you take morning, evening, and afternoon. Two drops. Then you see it. What will happen? Belladonna, gluonine. Okay, you take a gluonine. That is also good. Then you comment on this, like whether it works or not. If you really know, if you have gone through, if you have suffered, I know belladonna used for congestive headache and burning sensation. Okay, so have you taken this medicine? How you know this? An MBBS doctor will learn integrate. Oh my god, you're MBBS doctor and you being a MBBS doctor, you should be ashamed. Like you are just killing the patient. You are killing the patient. Nothing else you're doing. You're not treating. You're just killing the patient. I have worked in an allopathy hospital for 9 months, and I have seen what you people do there. You don't do anything. You just take a money. You just treat like a animal. We care so much for the patient, but you treat them. You treat humans like an animal. I have seen. Okay, so that's why 99% of people practice allopathy. No, no, no. You should actually you should go to the Kerala. Okay, you should go to the Kerala. Then you will understand why people are so educated in Kerala and they are practicing homeopathy. And most of the Malayalis were medicine evidence based, actually, not pseudoscience. Evidence based? What evidence based? What you are talking about? Tell me. What evidence based? Hmm? You should answer what I am telling. Like, okay, you do you agree that Malayalis or Kerala people are very educated? Okay, I have a friends. I have lots of friends. Those who have not taken a single dose of vaccine. Okay, those who have not taken even a single medicine for their suffering. Do you know this? I have lots of patients. I have studied from Karnataka, Bangalore. Okay, homeopathy work If homeopathy works, then why government not allowed to use in government hospital? Why biggest private hospital not use medicine? You should go to the Farooq Master. Where is he practicing nowadays? You should go and see. Okay, Farooq Master. He is in KM hospital. He has a OPD in that hospital. You should know this. Huh? You know Adil Chintanwala. You should know. He is also a homeopath. He studied allopathy, and then he converted into homeopathy. You know this. Out of 1 lakh, one MBBS does homeopathy. Otherwise, one. Why? You should question. You should ask those who converted into uh, homeopathy. Why they converted? What exactly happened? What they observed in allopathy and what they are enjoying and what they are treating in homeopathy. Okay, modern medicine is the only future. No. You actually, if you are allopath, and if you are just practicing medicine, okay, just practicing medicine, then I know you are scared of the homeopathy, because there is no difference between what you are treating and what we are taking. We treat better than you, okay, because allopathy is not for everyone. There is a difference between 100 marks and because allopathy is not for everyone. Why? See, allopathy, whatever I know, I have treated. I have seen lots of patient in allopathy hospital. Okay, lots of patient. Those who take allopathy medicine, at last they get suffer with the chronic renal disease. Okay, I have seen this. Okay, if if after taking the medicine, if their kidney is so it goes to so bad, then what happens? Okay, Saleh Gurshid, Dr. D.R. Patel Institute treating cancer patient only by using homeopathic medicine. See, you should see this. Okay, you should see this. There are lots of here uh, in Mumbai also, one doctor, he is also treating um, cancer. Okay, I forget his name, but yeah, he is also treating cancer. You are creating your own happiness, nothing else. You people are getting jealous, why? Because you don't have you are not treating, you are just palliating the disease. Okay, tell me why for every patient, why you are giving pan and MSET? With every drug, why you are giving pan and MSET? Why? Tell me this. If the person doesn't have a, a nausea and vomiting, why you give? I as far I know, there is two type of medicine: constitutional and therapeutic. Okay, why are you scared of homeopathy and homeopathic doctor? You know, the sarcastic boy. You just tell me one thing. You just tell me. Uh, why for every patient you give pan and MSET? Why? I'm not scaring. I'm just worried about normal peoples. You guys play with people. you you guys play with the healthy people. Okay? Huh? You don't know pan MSET. I know pan and MSET. I know for every patient pan and take pan MSET, take pan MSET, take pandy, take pandy, take. What is pandy? Why you are giving the fucking pandy? Okay, tell me. I am worried. Homeopathy doctors are worried. Homeopathy people are worried. Why protein pump inhibitor? Why homeopathy doctors are worried? Because you people are killing the patient. Okay, why in after taking so many medicine, why Dynapur is so injurious? Okay, why you people misuse those drugs? Okay, you people just kill the kidney. Okay, you just destroy the kidney for all the patient. You don't treat, you just palliate. After one patient comes with the one thing, and for any XYZ, you just give the medicine, or you take this medicine, and you just suppressed. After that, few days back again it will come, same disease. Okay, what treatment you have for allergic rhinitis? What treatment? Protein pump inhibitor. Okay, that is there. Okay, but why you give for every patient? What is the need? भाई if डायनापर 100 mg से ऊपर हो तो किडनी को नुकसान करता है. यू इवन नो डायनापर. भाई वही तो मैं बोल रहा हूँ कि हमारी कोई जैसे ऐसी मेडिसिन नहीं है जो नुकसान करेगी. ठीक है, हमारी कोई ऐसी, अगर ठीक है, इफ यू आर अ डॉक्टर, इफ यू आर एमबीबीएस डॉक्टर, you should you should know what is pros and cons in every system. Okay, what is, you tell me what is the pros and cons in your system. I am telling you that I don't have any cons. I don't have any loophole in my system. Okay, we treat patient without harming, without should we also take action for side effects? Obviously you should take, you should take. Okay, see, what usually happens, I have seen in a hospital. I'm telling you, I worked because I wanted to know what exactly happens in the allopathy hospital, what exactly happens, and there I worked around 6 to 9 months. Okay, so what exactly happens, the people come, they get admitted for the anything. Okay, surgical thing, leave the surgical thing. Surgical, we also accept surgical things, we cannot treat surgical things, but for medical management, why you are going to the, why you are treating them like a animal? It's just a placebo effect. Where from you are you doing RMO? I have done RMO. I have seen, I have my friend's hospital, I have gone there, I have I have gone there many times. I have worked 8 hours, 9 hours, 12 hours I have worked there. Okay. None of homeopathic medicine prohibited by any institute or government, but many allopathic medicine use are obviously, yeah, she said right. She said, right, like, okay, many allopathic medicine are getting banned. Why? Tell me why they are getting banned. But if they are not injurious, why they are getting banned? No medicine prohibited, only the potency inhibited. Oh, you have a potency. What potency you have? Huh? Tell me what potency you have. Hmm? Tell me what potency you have. You don't have any potency. You are just killing the patient with the medicine. You are giving the high dose painkiller. For everything you are giving the painkiller, take painkiller, take painkiller, take painkiller, take painkiller, and you just destroy your kidney and come back with the we will do the dialysis for the patient. Okay, then again I will earn the money. This same thing happens, no? Destroy the kidney, after that they will come, and do I know? Do I have to teach you everything now? For what? I am teaching you. You just I have, see, if I am working in any hospital, if I have worked in a hospital, they taught me everything. Okay, what exactly happens, and I have seen there what scam they are doing. Okay, what scam they are doing. I have gone through everything. Okay, only okay, surgical thing we know. If accident happens, if bones are broken, we can't do anything. We allopaths, we homeopaths never claim that, oh, we are going to treat the broken. I also agree that higher doses are harmful. Okay, you are agree that higher doses are harmful. Okay, now you tell me why allopathic medicines are getting banned in many places. Many drugs are getting banned. Tell me. Not only surgical, every case, acute, chronic, we work. Chronic cases you are working for what? You do you treat any? Okay, you tell me the difference between cured and palliate or treatment. What you treat. Okay, one patient is coming with the GERD symptom, the GERD, and you are treating. What treatment you are giving? You are just palliating. No, if bloating is there, take antacid. If this is there, take this medicine. Again after some times they will come. Why you? He is saying that He's saying that the medicine is not being banned, only the higher doses is being banned. Okay, why? Tell me why? Because it's harmful, right? Because it's harmful for the patient. Okay, homeopathy is a future. This you have to accept. Okay, and it's good you are learning allopathy, but I wish that you should convert into a homeopath and you see the miracles you will do in your future. Okay, if you are if you are trying, if you are thinking that you are going to practice in a clinic, then you should practice only homeopathy. Okay, if you don't believe, you should go to meet, or you should go and sit. You also have a in a internship, you also have a posting in a homeopathic uh, clinic, right? Anytime you have gone there, from where you learn homeopathy? Oh, I have learned the homeopathy from the very famous college, Father Muller Homeopathic Medical College. Okay, and they are the brand in homeopathy. Okay, they are brand. Anytime you have treated, uh, we treat infertility with homeopathy. We we treat gangrene with homeopathy. Okay, my friend is homeopathy doctor. He is not doing armorship. See, that is their wish, because start if you have not read, obviously you if you don't read, if you will not read properly in your internship, or you in your complete MBBS, then what you will do? You will start your clinic. You will start your RMOship, right? You will not, if you are getting specialized, and if you are going to do surgery and all, then it is well and good. We don't hate surgery and all. Okay, we accept this is surgical case, we are not going to touch this. But so there are two types of homeopath, right? There are obviously there are two types. There are many types of homeopathy, you can say. But classical and therapeutical. Okay, okay, yes, 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 you are right. For this I am agree. Okay, there are two types of homeopathy. Okay, so which is the best and work? Classical homeopath. If you want to live for long, then you have to practice classical homeopathy. If you want to shortcut, then you will give therapeutic, and you will end up with the like palliating the disease, like suppressing the disease, like you people do. Why not therapeutic? It's bad. I told you, no, therapeutic, we give medicine on symptoms, like okay, disease, this is the disease, these are the symptoms, and based on these symptoms, we will, if we give the medicine, the patient will get better. The patient will get better, not cured. There is a difference, better and cured. The patient will get better, but they will come back again. Are treating hypertension, MI, diabetes mellitus. Diabetes mellitus, yes, of course. Hypertension and MI, this is, again I'm telling you, if in starting you, if hypertension and MI both are treated, there are specialized homeopath they treat. I have never treated any hypertension and MI, but diabetes mellitus, yes, of course we treat. Because I'm telling you, I have a reason for this hypertension and MI. In hypertension and MI patient and hypertension patient, they already are very scared. Okay, they are already very scared that okay, what if I take homeopathic medicine and I'm losing my time? So they don't concentrate on this. They do go directly to the allopath hospital. Okay, because they don't want to waste their time. If they go to the proper homeopath, you know, uh, specialized homeopath, those who are treating only hypertension. Homeopathic medicine is itself sweet. How can you treat diabetes? This is very usual question for the, diabetes. If I'm telling you, if you are treating a patient with the metformin, or lots of drugs are there, Stamet and all, many brands are there. So you don't ask your patient to take, eat whatever the diet. You don't ask them to stop. They eat, right? They eat rice, they eat everything, they eat. So what is your planning to for stopping them? See, the dose is very minute, as we all know. Even homeopath and allopath, they know the dose is very minute, and it doesn't affect to increase the sugar level. Okay, we have a mother tincture, we have a similimum. For that we give the medicine to the patient and they get better. Even diabetes, there are so many patients, those who get treated by the homeopathy in a diabetes case. Okay, I know metformin. Met Steve Thomas said hi. Yeah, Steve Thomas. Hello. Metformin. See, metformin. Why metformin people can? The metformin is the one first drug. Every allopath start with for diabetic patient. After that they change the brand, or they change the medicine. Why? How can you treat PID? Pelvic inflammatory disorder. There are lots of medicine in homeopathy, bro. PID, there are lots of medicine in the PID. Okay, not one single medicine. Many patient, many. Not a single medicine. Many patient. You ask any female genital tract or female complaints. We have lots of medicine. How? Okay, if you have so much confidence in your system, psychiatrist patient, if you start giving the medicine, how you lower down the potential, how you, at what moment you know then why don't homeopath have branch like gynecological medicine, neuro? Bro, that is the best question for you, because you I think you have read so much about homeopathy, or why we don't have a branch, because we don't want to be tagged by, okay, this is the we are treating only this. Okay, we do 3 years MD in psychiatric medicine. That is okay. Let me complete the this is a very valid question. Okay, why don't homeopathy have branch like gynecologist medicine, neuro, cardio? I'm telling the answer. See, we are homeopath, we treat patient as a whole. This is the very simple answer. Okay, in that answer I'm telling you, a patient comes with the two patient comes with the same complaint for like uterine fibroid. Okay, uterine fibroid, and we have tagged, okay, this is the specialized only for the uterine, I am treating only female genital system, or female this, or gynecologist case or obstetric case, nothing like that. Every patient we welcome every patient when we treat them, holistic approach. We treat them like a, okay, this patient suffer with the uterine fibroid and this patient suffer with the uterine fibroid. We 99.9% we don't give medicine for same for this patient and same for this patient. This is the beauty of homeopathy. Yeah, now let me ask your question. We treat cardio, we treat neuro, we treat multiple personality disorder, we treat n number of neurological condition, we treat very well. Okay, now I have a question for you. Okay, we do 3-year MD in psychiatric, that is good. You do psychiatric 3 years. Now I have a question. Okay, one person start taking medicine for the uh, any any disease for psychiatric things. Okay, but at what time, like okay, sleeping disorder or anything, at what time you decide okay, this is the time to stop the medicine? Why psychiatrist people don't stop taking medicine? This is the very basic question from my side to you. You just hit me. If it goes, then it goes medicine. What is the meaning of this? You just hit me. If it goes, then it goes medicine. What is that? You answer my question like okay, we do 3 years MD in psychiatrist medicine. Okay, then why you people, why MD, why psychiatrist people, doesn't stop to take medicine? They take psychiatric medicine whole life, you know, and if they stop taking medicine, then the symptoms will come back again in a very severe form. How? We don't stop, we reduce the dose over time as we see improve. No, I have a patient, they are, they don't have courage to stop the medicine. They are doctor, they say, if you want happiness in your family, don't stop your psychiatrist medicine, you know. What improvement? You see, that is the thing. Then you are treating, you are just palliating the disease. You are not curing. Tell me what is the cure and what is the. I think he has gone. He will come back again, I think. Okay, how you, what is the difference? So you homeopath assuming that, assuming, see, we also see the world. We don't cure. Yeah, that is the thing. You don't cure. You allopaths never cure any disease that I can claim anywhere, that I can write in a bold letter and I can publish. You never cure any disease. Tell me one disease, allergic rhinitis, any disease. Tell me. You know what is cure? I give. I'm telling you what is my, thinking of about cure. Cure means after giving, still why is there so much demand for MBBS? Okay, this is okay. MBBS now. See, this is the modern medicine. Okay, and MBBS is doesn't not only means like okay, uh, go and practice. There are so many branch. Okay, we accept allopathy, we accept MBBS because of surgical cases, because of emergency cases. Okay, we never oppose, we never oppose allopathy. Okay, cure is complete treating of human being. Right. Then why you are giving medicine continuously? Why he is coming back with the same condition? If you are treating GERD, if you are treating gastric complaint, if you are treating the allergic rhinitis, why is coming back again for the same cough and cold or bloating of the abdomen, for diarrhea, constipation, morning diarrhea, whatever the disease? Why is coming back again? If you are curing, if I can claim, if even you know this, like if you give the medicine for lifelong, if a person is taking a medicine for lifelong, his kidney is going to be killed because of immunity, genetics, and other many factors. You have PSM subject? Yes, I have. Yes, we have all subjects. We have more subjects than you. Okay, we have more subjects than you. I can count n number of subjects we have, and we read everything. We read medicine, we read PSM, we read anatomy, physiology, pharmacy. We read obstetric, gynec, surgery, uh, and we have our own uh, subjects like maternal medica, organ, repertory. Immunity, what is the meaning of immunity? What you're telling about immunity, genetics, then why you are not giving for the immunity medicine? Okay, give the immunity, give the medicine for you know. You study to pass the VS, we study practically. What about CBDC? CBDC, what is that? CBDC. Okay, okay, that new for the new homeopath. This is there. See, we that is we don't deny that. Okay, homeopathy. Who who said we don't give medicine for enhancing immunity? Okay, you you are not understanding what I'm asking. If I'm coming with the allergic complaint, what you observe, allergic complaint or my immunity, and what medicine you give? If you are giving the medicine for the both complaint, allergic rhinitis and immunity, then why I am coming back again with the same complaint? You understood my basic question, basic question. Okay, why? If I am coming with the allergic rhinitis to you in your clinic and I have a weak immunity and you are giving me medicine, we first observe first pathology of rhinitis, whether it is bacterial or viral. Okay, okay, then treat on the basis of cause. Okay, antiviral. Okay, you are talking about antiviral and anti for dengue cases, for malarial cases, you are giving same antibiotic. Huh? Monosef, Panemset, and PCM. Give this like antibiotics and antiviral. This is your treatment, right? Hmm? Okay, I am okay. You are a doctor. Let's have a discussion, a good discussion. Like I am coming to you as a allergic rhinitis. I have a running nose and all things. I have a dust complaint, whatever allergic complaints, and yes, we give some antibiotic because we treat pathology. How, bro? See, antibiotics. How you are giving without knowing? I'm see, without knowing you'll give first you give. Okay, start. Okay, I'm going with the increased number of WBC and what C reactive protein. Okay, CRP, and you after seeing that, okay, uh, he has WBC, increased WBC. His temperature is high, and his CRP is this. Okay, start giving monosef 1 gram or 1.5 gram. Start giving pan MSET and 1 PCM or whatever. This 4 medicine you give, you'll be fine. What is that? Yes, we treat antibiotic because we treat pathology. CBC करूँगा. Kent is a allopath converted into homeopathy. Yes, yes, he is a allopath and converted into homeopathy. Yeah. Hmm. Yeah, Kent is a not monosef direct. bro, bro, I think you are still a student. You are not a doctor. I know. Chashma uh, doctor, if you are working, no, for every case I'm see I have I'm from Mumbai, right? I'm from Mumbai, so I know I have worked in a hospital there. For every case, you know, for every case they give monosef pan set, you know, for every case. And then after that some higher antibody. If the case is cashless, they have a money, they give meropenem and lots of antibiotic without knowing. Okay, take this medicine, give, he will be fine. And after that, All antibiotics are resistant now. See, PG, PGM. He also is telling all antibiotics are resistant now. Different, different. Thanks for supporting. Different medicines are given in hospital and you give medicine for in OPD. You give medicine for the patient to get more worse, and they go to the hospital and get admitted. And after that, getting admitted, you people earn lots of money. You take 5,000, 10,000 for the bed charge. Then after that, you give this medicine. Then you give the antibiotic. Then you give saline. Then this, that, everything you will do. You never treat. You never cure any disease. This I can. You know only one thing. Okay, patient came with the complaint of this. Antibiotic resistance is occurring because BMJs allowed BHMS doctor to prescribe antibiotics without even having the knowledge to do so. even even a proper allopath, even a MD physician I have seen without knowing anything, yes, prescribe this. Which doctor should I consult for fat loss? Afraid shake. Afraid shake. Okay. Uh, Fat loss. Where is the fat? Central obesity. Overall fat. See, the very good question came from the Afri Sheikh. Allopath, what they do? They just cut belly fat. Belly fat. Okay, Afrid. Yeah, there are lots of medicine in homeopathy. Your belly fat will reduce like around 2, 3, 5 kgs up to 6 months. It will get reduced without getting operated. Bro, BHMS have pharmacology subject in CBD. Yes, yes. Now it started. Yes, now it started. Because now even everyone should know which drug will cause the adverse effect. Why homeopaths are very sensible to treat the patient? Because they don't want to uh, they don't want to harm the patient more. Okay, PG, bro, we study pharmacology for 3 years. You end up in 1 year. You study pharmacology for 3 years, and what you people do? You just kill the patient. You just kill the kidney. You just destroy the kidney. Hmm? Hmm? You just destroy the kidney. How many? Because of what dialysis patient comes? Because of you people only. If Hahnemann alive now, allopaths kick out of from this. This is the best answer I have got. If Hahnemann's alive now, allopaths kick out of from. Obvious, yes. This is the best answer. Hahnemann was allopath. Why he left? Because he knew this is very harmful practice. Can you prove how kidney affects? How kidney affect? Bro, after taking, see, creatinine, if a person gets at 30 or 40 years of this diabetes, and he start taking the medicine for diabetes mellitus, and after 3 or 4 years, after 6 or 7 years, his creatinine level will be increased, at an one moment his creatinine will be too high, he will go for the dialysis, and the game is over. Once he go to the dialysis, his life is over. You are so obsessed with this pseudoscience. I am not obsessed. I am not a blind followers. No, I am not a blind followers. No, I have seen, I have treated, so I have a confidence. I am not a blind followers. Who said increase and tell me which medicine and how it will increase? Every medicine. If you take continuously allopathic medicine for the long time, your kidney will go. That I have seen. I had a friend who once took allopathic medicine for the simple fever, and his kidney got failed. Tell me evidence. He died. He took dialysis. After that he died. He was very young. Yes, then tell me the name. Tell me the name. Okay, you want proof? I'll show the proof. Okay, if you want the proof, I'll come again tomorrow. Same time I'll come again alive. I'll show you the proof. Okay, this is very healthy conversation. Like, okay, you want to proof? I will show you. Okay, I will show you. Salia Ghosh, MBBS doctor itself told me don't use diclo more. It will harm for kidney. Obviously, see, diclo. The MBBS doctor they say that oral medicine don't take too much. Oral painkillers don't take too much. It will affect the kidney. Why they say? All painkillers, obviously, yeah, all painkillers are harmful for the human body. Nephrotic syndrome are you able to cure allopathic hospital? No, that we cured nephrotic syndrome. Are you able to? Yeah, allopathic See, this is the thing. Allopathy people they just kill the patient. I, you know, people get admitted for one complaint, and they when they come out from the hospital they get one more complaint because I say it's a nephrotoxic in high doses. For simple doses also, high what kind of dose? What you are telling? If I am taking for 10 days or 15 days one painkiller, what will affect? It will affect to my kidney. Even a small dose or big dose also, high dose also, it will affect to my kidney. Who said? I have observed. You come out of the college, you start practicing, or you go once to hospital, then you see how many dialysis story you just who have gone for the dialysis, who used to come to the dialysis, ask them what exactly happens, why you are going for the dialysis weekly, 2 times, 3 times, why every day dialysis, why it is happening, what exactly happened to you. They will tell you what exactly happened to them. I came with this complaint and this happened to with me. I took allopathic medicine, after suddenly I got this problem, and my doctor said now you are in a dialysis. Why this is happening? Obviously, see, the very good question, the very good point. In allopathy, there is a simple rule: if something is disturbing, just remove it from the body. Obviously, see, this is the thing. Fibroid case, hysterectomy. What is it? What you know about hysterectomy? Hysterectomy. What exactly happens after removal of the uterus from the female body? What you do for the hormonal disbalance? If a patient, if a lady is coming with the fibroid uterus, what you do? You just remove hysterectomy, do hysterectomy, remove the uterus. After that, what they will get suffer, what will happen to them, you don't know. Then you do something. What you will do? How you will treat the hormonal disbalance? Hmm? You don't have any medicine to treat the fibroid. Huh? Then if you treat them with your for some things only surgery is best. See, I told you, no, for something only surgery is best. For that you go for that I will accept. Okay, sir, allopathy is good. The famous pulmonologist, they are Jaswant Patil convert into homeopath. He is allopath. Yeah, Jaswant Patil. I know. I have seen his video. His mother was his mother was about to die, so ars iod was the medicine was given. Yeah, we can give this hormone as medicine. You only you the patient came with the one simple complaint for uterine fibroid, you just removed it from the body, and after that you are giving again, you want to run your clinic, so you start with the hormone therapy. What kind of system it is, bro? What kind of system? Tell me what kind of system it is. Hahnemann knew that this system, this allopathy system is the bad. Hey friend, if one person out of 1 lakh converts, then you talk about greatness to him. Bro, lots are getting converted. Even allopaths children are taking homeopathic medicine. Why? Because homeopathy treat like you know, miraculous. Miraculous. Homeopathy treat patient like miraculous. For children, for old age people, for young, for uh, adolescent, for everyone. Homeopathy originated in Germany and has become the homeopathy of the north. What kind of, you are just, see that, I don't know from where you got this information. Like, you anytime you get, you know, any disease, I hope you should not get the disease, or you should not get, you know, but if you are getting anything in your family or anyone, you just go to the one homeopath and take medicine. Ask them, a good homeopath, you go and ask them to give this medicine. Or any migraine case, the best example, if in your family or any relatives or anyone getting migraine, then you go and get a good homeopathic doctor, then you see the miracle. I took medicine for urticaria, but it doesn't work. You don't take. You take from the homeopathic homeopath. Okay. You take, even psoriasis are getting treated for my auntie. That is, I'm telling. You take medicine from a good homeopath. Okay, and you seeing a watching in a YouTube, like, okay, take which medicine is good for the what, urticaria. Okay, take this medicine. No, 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 we don't treat medicine. If you type in a, now in chat gpt, if you type a medicine, you type this a good suggest 5 medicine for the urticaria, you will get lots of medicine, but you don't take those medicine. Okay, you don't take this medicine, you go to the certified homeopath and take the medicine from them. I'm challenging you, I'm betting you that you will be cured. Homeopathy, yeah, this is the thing, homeopath may fail, but homeopathy never fails. Before microorganism existence by the microscope, Hahnemann already it named as miasm. Yeah, he is very good. He has a deep knowledge. PG, BGM. Miasm. You know what is miasm? You know, chronic disease. How you treat the chronic disease? How you treat the chronic disease? Tell me. Same protocol you have. If I have allergic, any number of, you know, evidence has to be given, sir. Just talking does not cure it. You come out of the shell, and see the world of homeopathy, then you will understand what evidence you are getting. You attend some seminar, you Jaswant Patil sir's video you watch, or you go attend to Dr. Batras you see, or Farooq Master you see, a good homeopath you go and see. You will be amazed, you will be surprised. Which chronic, tell? Okay, tell me. I'm simple. I'm telling you, allergic rhinitis. How you are going to treat allergic rhinitis? In my 99% homeopaths are doing allopath by doing bridge. That I'm telling you, no, that is their problem, bro. That is their wish, because they want to earn. They want to that do only. We already talk about allergic rhinitis. Tell me, allergic rhinitis. Tell me, migraine. Okay, tell me, migraine is also a chronic disease. Tell me, migraine. What you do for the migraine? Tell me, what you do for the migraine? How you treat the migraine? Okay, I tell you the symptom. We have some medicine for migraine. Some medicine. You cure this or not? Will you cure? Okay. I have a, if I will tell you my story, or then I have evidence also. Okay. Like you, I was also a normal guy who was, I was unaware of uh, allopathy, homeopathy, ayurveda, because I belongs to healthy family. I never took any kind of medicine. But in 2014, 15, 16, 17 and 18, in those Disprin, Ibu, Disprin, how long you will give, bro? How long Disprin you will give? Okay. Disprin, ibuprofen, Ibu. These two medicine, sorry, will cure for every migraine case. If you are claiming this, if you are claiming this, I will write a one note for in my. I will stop practicing homeopathy. Okay. For Disprin and ibuprofen, I will give for all the migraine people, and it should get cured. You are telling yes, it will be cured. No. I want 99 cured. They should never get the attack of migraine in the whole life. They should never get the attack. You know, the maintaining cause also. Yeah, this is the, see where you all gone during COVID-19. Only homeopath treated the patient. See, do you agree? Kerala is the best. 100% literacy is there. Yes, success ratio is 99%, but for homeopathy it will just success. Right. So they will never get the attack. How long it should be taken? Your Ibu and what is that? Disprin? How long? Tell me how long it should be taken. Your Ibu and Disprin. कोविड में भी एंटीवायरल एमवीआई आईवी फ्लूइड्स ही देते थे. अच्छा, तो मैं अपना केस बताऊं. हाउ यू विल ट्रीट. ओके, आई विल टेल यू द सिम्टम. हाउ यू गोना ट्रीट दिस. This is not a made up story. I have a prescription of the doctor. Okay. Agree. Okay, fine. Now I am telling you BD, 10 days BD. Okay, fine. Now I have a, just listen for 1 minute, then I will tell you, then you tell me the drug. Okay. After getting up from the morning, in the morning I used to go to the bathroom. First, like we all do, we all go to bathroom. After that we come back and we do our breakfast. what I was getting, what I was suffering with, मॉर्निंग में बाथरूम करने के बाद अपना नॉर्मल फ्रेश होना, नहाना धोना, फिर उसके बाद मैं क्या करता था, नहाने जाता था. नहाने के बाद फिर अगेन नाश्ता करता था. नाश्ता करने के बाद फिर से मुझे वॉशरूम जाना पड़ता था. दिस वाज द कंडीशन. ओके, मॉर्निंग में ही होता था. ये क्या होता था, दे ट्रीट द डिजीज, वी ट्रीट द पेशेंट एज अ होल. यस, दिस इज द वैलिड पॉइंट फॉर होम्योपैथ. सो सार्केस्टिक बॉय, आर यू लिसनिंग मी. तो क्या होता था कि मैं मॉर्निंग में उठता था, बाथरूम जाता था, नहाता था, नाश्ता करता था, और फिर अपना नाश्ता करने के तुरंत बाद गैस्ट्रोकोलिक रिफ्लेक्स होता था मुझे, फिर से मुझे बाथरूम जाना पड़ता था. ठीक है. और मेरे बॉडी में कुछ भी नहीं, वेट मेरा हो गया था 46. ठीक है, 46 वेट हो गया था मेरे बॉडी में. कुछ भी खाना था, कुछ नहीं होता लगता था. और ये जो बाथरूम का प्रॉब्लम है, वो मैं दोपहर में अगर खाता था ना, वो नहीं होता था. रात को भी खाता था, खाने के पहले, खाना खाने के बाद नहीं होता था. ये सिर्फ मुझे कब होता था, मॉर्निंग में ही होता था, ठीक है. दैट्स जस्ट फिलोसफी, वी ट्रीट पर्सन एंड ऑल. what, okay bro, that you live, what I am telling, that you listen, that okay. तो ये प्रॉब्लम होता था. तो मैं एक एलोपैथ के पास गया, ठीक है. तब मेरा एडमिशन मैंने ज्वाइन नहीं किया था, 2017 की बात है. मैं एलोपैथ के पास गया, उन्होंने मुझे लिस्ट ऑफ मेडिसिन दिया, ठीक है. और उन्होंने बोला कि तुमको पूरी लाइफ, आई एम टेलिंग दिस, पूरी लाइफ मुझे नॉनवेज नहीं खाना पड़ेगा, मतलब खाना चाहिए. यू स्टॉप ईटिंग नॉनवेज, इंक्लूडिंग फिश, meat, any sort, any kind of, have done colonoscopy and all, every things I had done, bro. I have this report I have, because I was suffering with, okay. I have everything. तो मैं उसके पास गया, तो उन्होंने मुझे क्या बोला, आई एम गिविंग यू मेडिसिन फॉर द 15 days, ओके. और आप ये मेडिसिन लीजिए, और आपको नॉनवेज नहीं खाना पड़ेगा, ठीक है. और वो 15 दिन की मेडिसिन अराउंड 1500 रुपये लगे थे, ठीक है. उन्होंने मुझे एडमिट नहीं किया था, क्योंकि उतनी ज़्यादा भी सीरियस प्रॉब्लम नहीं थी, बस यही था कि सुबह में मुझे ये सब करना पड़ता था, ठीक है. तो अब मैं कॉलेज में गया, ठीक है. कॉलेज में गया, और कॉलेज में जाने के बाद मुझे सेम कंटिन्यू क्या होता था. उन्होंने जो मेडिसिन मुझे दिया था, मुझे डायरिया की जगह पे कॉन्स्टिपेशन होने लगा. ऑब्वियसली यू आर एंटीपैथी, सी एंटीपैथी मीन्स opposite. If I am getting diarrhea, you will make it constipation, okay. Antipathy same. So मैंने दवा लिया 15 दिन के लिए, फिर मेरी दवा वो 1500 रुपये की ऑलमोस्ट. और फिर वो कंटिन्यूस मुझे, मैंने जैसे ही दवा लेना स्टॉप कर दिया, तो मुझे सेम चीज़ें फिर से होने लगी, ठीक है. अब मैं क्या करूँ बताइए आप, मुझे क्या करना चाहिए था. मुझे फिर से वही दवा लेनी चाहिए थी. मैं पूरा चेकअप करने. अब मैंने बोला ना कि एलोपैथ दे नेवर टच अ केस विदाउट एनी इन्वेस्टिगेशन. यू आर एब्सोल्युटली राइट, बिकॉज दे नो, दे वांट टू ट्रीट, दे वांट टू नो व्हाट एग्जैक्टली हैपन टू दिस पेशेंट. तो अब मुझे क्या करना चाहिए, आप बताइए. मैं जब भी मैं ये खाना खाता था, सुबह नाश्ता करता था, मुझे वॉशरूम जाना ही जाना पड़ता था. आई हैव अ प्रिस्क्रिप्शन, आई विल पब्लिश दिस. क्रॉनिक डायरिया हो गया था मुझे, ठीक है. गैस्ट्रोकोलिक रिफ्लेक्स, क्रॉनिक डायरिया, वट एवर नेम यू गिव. You should modify lifestyle. What lifestyle? Tell me what lifestyle. What lifestyle? I should stop eating non-veg. I should have stopped. What kind of lifestyle? Tell me. तो आप ये कहना चाहते हैं कि मुझे जो उस डॉक्टर ने जो वो, यस, एंड वन मोर थिंग, लाइक वो MBBS डॉक्टर ही था, ही वाज MD, ओके. if we modify the lifestyle, why we yeah, see, this is the very good you haven't done bro. I have done, I'm not lying. I have done investigation. What kind of investigation you want? I had done investigation. I have a proof. Then tell me now, what kind of lifestyle I should have changed. Because in future, if which year you are, yeah, sarcastic boy, which year you are. So according to you, nothing came out in the investigation. Yes, absolutely. There was nothing in my investigation. I am doing internship. Yeah. Then you have a knowledge. You have some knowledge because you are doing internship. It's good. You are doing internship. Now tell me what. Nothing came in my investigation at all. Nothing. I'm literally, I'm saying nothing. I'm not making a story. Nothing. So I don't, bro. See, this is, you should believe. No, I'm a doctor. I'm telling in a live. Okay, I'm telling in a live, and the person who witnessed this, whole college witnessed this, whole family, whole society witnessed this. What exactly happened to me and what I was going through. Okay, without pathology, it is possible. How it is possible? Okay, GERD. What pathology is there? Bloating of abdomen, diarrhea. What pathology? It was chronic, no? How the CRP and all thing will be raised? It was chronic. Then how? What pathology you want? I had done multiple times USG of abdomen. I had done multiple times of LFT, RFT, uh, pancreatic test, liver, GERD spasm में cardiac expansion hamper होता है. Without pathology, we all well versed in pathology, bro. Obviously, we know everything. What exactly happened? We know the in the body what is happening. What is happening in the mental? That you don't know. What mentally happened to with me? What exactly was I was going through? That you don't know. You just because you don't want to listen. You want only one thing. If investigation is there, I am going to treat. If investigation is not there, I am not going to treat. That is the same thing. If I am telling you, if a person is coming with the sinusitis, why? What you do? You will remove the sinus and all things. What? This is the cure. Huh? Sinusitis, I am coming. You will remove the sinus and all things. Huh? This is the cure. This is not a cure. You are just killing. Sinusitis, it is very well treated in the homeopathy. Sinusitis. Okay. I have treated lots of patients. I have treated one case. The person was suffering from allergic rhinitis from many years. Whenever she used to take a cold things, anything, she used to sneeze a lot. I just gave one packet of medicine, calcarea because it was her constitution. She was wonderfully. She was so happy the next day. You always, yes, treating cause its cure. Treating cause. So I have a headache. You remove my head. Huh? I have a eye pain. You remove my eye. Or I have a fibroid. You remove the uterus. Hmm? I have a stomach abdominal pain. You remove the abdomen. Hmm? I have a stone. I have a stone in my kidney. You just remove the kidney. Huh? I have a stone, you remove the stone. Wow, what kind of system it is? Anytime you try to, yeah, this is the so according, head is a cause for headache. You said no. We just remove the cause. That you should know the cause. What is the cause behind this? I am telling you the cause. You are not listening my thing. Okay, when I was going in a allopathy hospital just to see what exactly happens. So there were lots of patients coming for the kidney stone. Nowadays, the kidney stone is it is like becoming, for every patient kidney stone is there. What a joke! Are you really MBBS guy? Shall we talk about, bro? Yes, we should talk. Sarcastic boy, I'm inviting you. You should come tomorrow again from 9 to 11 or 8 to 11. I will come again daily live. You just I hope you subscribe my channel just to get notified. And obviously you are getting late, or you have to go tomorrow for the clinic or your internship program. So really, You subscribe my channel. Tomorrow we will talk again. And yes, 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 I will come. Thanks. We will discuss. We will discuss, and I will come with the proof. I will come with the lots of cases which I what I have treated, and I will show you. Okay, publicly. Okay. Thanks PG BGM bhai. Thanks for subscribing. Thanks, because there is a lot patient in my ICU. Yeah. Okay. So thanks. I hope PG BGM you subscribe my channel. Thanks for subscribing. Thanks. तो कल मिलते हैं. I hope. Okay. Bye. Thanks for watching. Thank you. We will discuss tomorrow. Thank you.